Welcome, everybody. We are going to start our 1240 presentation. We are promoting commercial tobacco cessation to improve oral health outcomes with our presenter, Ndekela Sakala, from the Oral Health Community, and she is the Oral Health Community and Equity Coordinator for the Minnesota Department of Health Oral Health Program, with contributions by Clare Larkin, our friend Clare, many of you know. This presentation will be about current trends in commercial tobacco use, how commercial tobacco use can lead to poor oral health outcomes, and how we can promote commercial tobacco cessation through dental public health messaging. So I will turn it over and welcome Kala.
Thank you. So yes, hi everybody, my name is Ndekela Sakala. I also go by Kala, whichever, either or. And so we just started a project recently with our commercial tobacco team over at the Minnesota Department of Health. They're housed in our injury prevention and mental health division. And so one of the things we wanted to do is promoting oral health and using that from a dental perspective, and also just sharing some resources with some of our dental partners on different ways they can use motivational interviewing, cessation medication as well, and just other ways that we can promote these in our clinic, and how we can also be culturally specific because commercial tobacco is different than other forms, so I will speak about that as well. And that's me. And yeah, so I worked with Clare Larkin. She helped me develop a lot of this and helped me just make sure that while this one is more public health based, we're also uploading one with the Minnesota Dental Association so that we can update some of the modules they have on their website. But they do have pre-existing modules too, and I'll have a link to that it'll be a little QR code so you can just do the thingy and then you'll get to the website. So one of the things that I do want to do is have our tribal state relations acknowledgement. The state of Minnesota is home to 11 federally recognized Indian tribes with elected tribal government officials. The state of Minnesota acknowledges and supports the unique political status of tribal nations across Minnesota and their absolute right to existence, self-governance, and self-determination. This unique relationship with our federally recognized Indian tribes is cemented by the Constitution of the United States, treaties, statutes, case law, and agreements. The state of Minnesota and tribal governments across Minnesota significantly benefit from working together, learning from one another, and partnering where possible. The Minnesota Department of Health recognizes and values and celebrates the vibrant and unique relationships between the 11 tribal nations and the state of Minnesota. Partnerships formed through government-to-government relationships with the tribes will effectively address health disparities and lead to better health outcomes for all of Minnesota. Part of how the oral health program moves forward from statement to action is we promote education on Indigenous practices to avoid stigmatizing them. And in our work, we demonstrate this commitment in one of the following ways, which is partnering with the Great Lakes Intertribal Epidemiology Center on gathering and analyzing data on American Indian adults and oral health. And so that's an upcoming project we'll be doing.
I'm sorry.
Yeah.
For some reason, I was moving.
And so I know we just discussed our tribal relations acknowledgement, and again, I just want to say because of our relationship with those 11 federally recognized Indian tribes, we always want to move from acknowledging our relationship to having an action behind it, which is promoting education on Indigenous practices to avoid stigmatizing them with a Western perspective. And in our work, we also are partnering with the Greater Lakes Intertribal Epidemiology Center so that we can work on gathering and analyzing data on American Indian adults and oral health. And then just the land acknowledgement too. Every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy into making the history that has led to this moment. In Minnesota, we're standing on the ancestral lands of the Dakota people. We want to acknowledge the history of this land, including the Dakota, the Ojibwe, and the Ho-Chunk, and other nations of people who also call this place home. Native peoples were removed unjustly, and we are in this space as the beneficiaries of that removal. At MDH, we understand that the land is related to health, and we want to be a good steward of the land we're on. This acknowledgement is just one piece of that. We understand that the systemic racism, historical trauma, and genocide that has impacted Indigenous communities and people in our state we recognize that a land acknowledgement is just the first step. And we have talked about that supporting this action with resources and shared decision making so that we can meet tribal public health priorities and needs. With our Indigenous neighbors and coworkers, we can advance health equity and work to ensure all communities across the state are thriving and all people have what they need to be healthy. We encourage state employees and the public to research the history of the lands we're on, and if you're able, find Native-led events to attend, organizations to support, and causes to champion. And also part of the reason it's important that I did this is one of the things I really want to talk about is the difference between sacred and ceremonial tobacco compared to commercial tobacco. Describe tobacco and some of its derivatives. Identify current tobacco use rates and recognize the use of cannabis as an emerging assessment point in patient health histories. And then we'll also just give y'all some of the educational resources in order to understand more about this subject as well. And another thing, I'll say dental professionals, but that's like anyone dental adjacent, so dental public health, dentist, dental hygienist, dental assistant, you're all included in this because it is on all of us to be able to promote commercial tobacco cessation. And so I'll do a quick little self-reflection if anyone would like to answer. At what age were you first aware of cigarettes, pipes, and cigars? You can also yell out a number.
Really tiny kid. My uncle smoked a cigar, and my mom, or he smoked a pipe, and my mom smoked cigarettes.
Mm-hmm.
And from the time I was born, really.
Yeah, so it's very formative. Mm-hmm. And anyone else have a? I know for me it wasn't actually until I moved to America, and that was when I was 7, and so that's when I kind of saw it more often. Things are just slightly different back home, but now rates of smoking are increasing too. And I know, Jane, you just mentioned growing up with family who did smoke. Did anyone else also grow up in a secondhand smoke environment too, whether it's in the house, in the car? Mm-hmm. And that's also something we're going to talk about too, is the importance of secondhand smoking, which people think you don't get from vapes, but you do. And then, if anyone's comfortable with this, what approximate age were you when you first experimented with tobacco or vaping products? I'm going to call myself out. First of all, I think I was a senior in high school, and everyone started with those little vapes, and we're like, no, it's safe. No, it's flavored liquid that's causing your lungs to have popcorn in them. And so would anyone feel comfortable just even sharing that piece of information? I will so not put you on the spot. Awesome. But I am still glad I was able to share that because I don't want it to be a person being stigmatized for that behavior when we're kids and we're curious, and ideally this wouldn't be promoted to us in different ways.
I can share. I was in college when my friends invited me over to do hookah, and I grew up with 2 parents who were smokers, and I was absolutely against smoking, and I thought that hookah was different. And I was just like, oh yeah, we're going to do this thing, and it's fun. And it wasn't until starting to work in commercial tobacco prevention that I was like, oh, okay, I was smoking a pack of cigarettes in one session.
Yeah.
2 packs of cigarettes.
And that's the same thing as people were like, oh, it's vaping, it's fine because it tastes like strawberries.
Yeah.
And it's like, ideally no, but that's also how it was marketed to us, is this is a safer way to get this. This is a safer way to feel that like nicotine feeling. I don't know how to best describe it with better words. But so, starting with tobacco, one of the things about tobacco is it is derived from the leaves of the plant that's here in North and South America. And once it's harvested, usually people will cure it, age it, and process it so that you can end up smoking it. And that shows up in different ways, whether it's cigarettes and cigars, hookah, and then other ways that people may apply to the gums as well. And again, one of the things I really want to put an emphasis on is there is a difference in uses of tobacco between our people who are American Indian and Alaska Native. And so one of the ways it's called is kansana or kansasa or asama, based on whether you're from the Dakota tribe or the I'm so bad with words, Anishinaabe tribe, area tribes. And so the thing with commercial tobacco is it's been used for spiritual and medicinal purposes. And unlike commercial tobacco, where it's processed and you have like 1 billion chemicals that are put in it so that it's a little more addictive, It's carefully hand prepared and it's offered as part of prayer ceremonies and healing. And the most important part is it is natural and it's not meant to be addictive, it's not inhaled, and it also doesn't have any of those additional additives. And whereas commercial tobacco, that's manufactured and sold by the tobacco industry. So again, cigarettes, e-cigs, cigars, and this also kills over 6,000 Minnesotans every year. And the public health burden of it is also 4.7 billion annually. And here in Minnesota, it is the single most common, single greatest preventable cause of death here in Minnesota. And so that's why I emphasize that it's kind of on all of us, regardless of what professions we're in, to promote this as just a general health thing, including oral health too. So some forms of tobacco, one of them is like the hookah pipes. And so that's what we kind of talked about earlier. One thing that people may not know is hookah can actually be, over the course of an hour, like I want to say, and please correct me if I'm wrong, Lucy, almost like 100 cigarettes that you've smoked over the course of that hour. And usually people will stay that way. It also has a higher nicotine content than both cigarettes and vapes, and it is definitely not a safer alternative. So for vaping and e-cigarettes use like a little battery and they heat up some liquid that's in a cartridge, and that usually contains nicotine. I will say too, note on that, some people will use marijuana in the same way, which is putting the concentrate in a little thingy. So it has a higher concentration than you would maybe in cigarettes. And so with that juice, it kind of comes with a lot of different things that are also similarly found in things like jet fuel, such as like propylene glycol, different flavorings, which makes it more addictive to children, and why there was a Juul lawsuit, because they were like, this is fruity, this is good, and kids were getting more interested in it because it was different. And also with vapes, that's the most commonly used tobacco product by American youth. So that's 1.6 million youth that are reporting usage of cigarettes in 2024. And the other thing too is a lot of especially teenagers think that vaping is safer than using combustible products such as cigarettes, which again, similar to hookah, is not true. And it does have other things that it does introduce to your system that smoking cigarettes may not that one is better than the other. And the thing with vapes too is that they're overly accessible. And so you can disguise them as inhalers, which is unfortunately ironic, watches. People will take them to school, smoke in the restroom. I remember I saw a video on like Tumblr of a kid who was just in at their desk, and what they did is they took a hit of their pen, went in their backpack, and that's when they let the smoke out, which was an interesting thing to see, is just how easy it was for that student to do it in the school, especially with the teacher's lack of awareness of what this product may be. And then the other thing with commercial tobacco use is this is specific to vaping, there's also secondhand aerosols that are associated. And so those aerosols, they're exhaled by vaping, and they contain nicotine, heavy metals like lead, nickel, and cadmium, other cancer-causing chemicals such as formaldehyde, which, as we know, is used to embalm dead bodies, and acetaldehyde as well, and other ultrafine particles which can make their way into your lungs and may stick more easily in the lungs as well. This can also expose bystanders to many of the same harmful products as vaping firsthand. And again, because a lot of people felt like vaping was less serious than smoking cigarettes, they would vape around their friends. Their friends may also not know that they're still getting secondhand smoke. And this, unfortunately, because of how new vapes are, is not as well researched. So we may not know everything about the actual impact on the body, but we do know, again, it is a form of secondhand smoking, or secondhand smoke. And so the more common type of secondhand smoke we talk about, this comes from commercial tobacco products such as like cigars, cigarettes, and even hookah. And it includes the smoke that's exhaled by the person who is doing the smoking. And so this can contain over 7,000 chemicals, and this has been much better studied because cigarettes have been around for a lot longer. And so most of these are dangerous. A lot of them are cancerous. And again, smoking is the most preventable cause of death here in Minnesota. And so that's always something to think about, is not only are you also exposing yourself to this, it does matter to the people around you. Also, there is no safe level of exposure to secondhand smoke. The other thing about secondhand smoke is it can actually sometimes stick in rooms and on clothing. So someone may think, I went and took my smoke break outside away from everybody, and then I came in. But if that person gets really close to other people, and especially with children who are more susceptible to this, they're still being exposed in that way. Or if somebody smokes in a room, for example, continuously, that's another way that it'll stay more regularly in that room. And I don't want to assume anything for anybody, but I know I have friends with family members where they knew that those family members smoked, even if they hadn't done it recently, because of a certain scent that was in their house that wasn't as noticeable to the folks that were smoking. So yeah, even the brief exposure can be really harmful. So the dental consequences, I don't know why I put dental consequences of oral health, but it's called dental consequences of smoking. This can be everything from periodontal, so that's what you can see here at the roof of the gum. Tooth decay is a really big one, which you can also see here with this person's restorative fillings too in their crowns. Dry mouth, which is xerostomia, halitosis, which is also bad breath. And also if somebody has any wounds in their mouth, or if somebody just got gum surgery, anything like that, it leads to poor wound healing. So that person's not able to recover as quickly from any surgeries that they've had. And smoking and cancer. We've all seen a lot of different smoking awareness campaigns for smoking and the relationship with cancer. So smoking causes about 20% of all cancers, which I think is the majority of it, and 30% of all cancer deaths in the United States. So 80% of lung cancers and 80% of all lung cancer deaths too are all due to smoking. And it's the leading cause of cancer death in people here in the US. And then for mouth cancer, it's 90%. So 90% of all mouth cancers can be attributed back to smoking. And so one thing I also want to mention here too is none of this is meant to stigmatize the patient if they're smoking or anybody who is smoking. What it may mean is either they know and they may have a hard time stopping, or they don't have as much information, especially if they're not here, because some of our materials that are anti-smoking may not necessarily address the cause of smoking and may not really look at how people are smoking and that information, which is why we were very intentional about including vaping, because it's so new. And the hygienist, Clare Larkin, that I worked with, she was like, I have never heard of this. And she was able to do a lot of research thanks to ABC. ABH, I'm sorry, I don't know where the C came from, but the C was for cool, because y'all are cool. And so, yeah, none of this is meant to stigmatize people. There's a lot of different resources for patients to be able to use in order to be able to help them. What a lot of people really need is support and compassion. I feel like compassion's been kind of the theme of today, but that is one of the biggest things, is some people may feel ashamed of it, you know? It's like you hear a lot of anti-smoking campaigns, you start to internalize that, and it feels like a moral failing and not just a health issue, an addiction, you know, part of its own disease. So that's one of the things I always want to emphasize too. So some of the questions I kind of have for y'all here, I know I have very limited time too, so I might also like rush through this. Any one of these questions, so are any of you dental providers or medical providers? You can raise your hand. Awesome. And so are you able to address commercial tobacco in like patients, or is that something that's able to come up in your workflow? Because I know you also have very limited time to be able to do the services and the counseling for OHI. So is that something that's noted in your workflows? Mm-hmm. Yes.
I would say when I was practicing hygiene, it's sort of like, you know, you mention it, maybe give them a flyer or like, you know, mention the risk to their oral hygiene, but, you know, maybe it's a few sentences.
Yeah. Yeah. And I think one thing that I also wonder too is, are there like resources, like pamphlets or something that we can give to providers that they can maybe just give to their patients? Because again, it is sometimes a longer conversation, especially if motivational interviewing is involved. Does that seem like something that could kind of assist in there, where it's like, hey, I know you smoke, here's this resource? Does that seem like something that knowing your patients could be helpful for them? Sorry, I'm like putting you two on the spot. All right, and then the other thing that I want to know, not all states do this, but some insurances or some Medicaid services do include tobacco counseling codes. So in some places, that's a reimbursable service, which is another way that we can be promoting tobacco counseling in multiple different fields. And so there's a lot of oral health strategies, and I will go through these. But one of the biggest ones is integrating that treatment to clinical practices. This is for both medical and dental. And so sometimes providers are able to identify and support those patients who do want to quit, just even by giving them that resource, that pamphlet, because one of the things we like to say is every quit is a try. And that's important because that's more motivational than just stop smoking to a lot of people. And so a lot of patients may not seek to quit on their own, even though like they want to stop. So they do need that additional support, compassion, and just listening. And also medical providers and dental providers are able to provide, again, counseling, medications to help stop smoking and nicotine use, and different behavioral support too. And also being a resource sometimes for the patients is just, can they maybe at some point ask you for what will happen if I continue smoking or anything like that, or a website they can go to. And the other thing too is promoting a tobacco cessation friendly clinic. So tobacco cessation goes way deeper than just patient care. It also involves creating a supportive environment for your staff members to be able to implement, to foster a culture of wellness that can help promote like commercial tobacco cessation for your patients, your staff, and then that also gives them the ability to learn more about how it impacts their oral health, and also be able to kind of pass that on to their patients if that's a step. Offering comprehensive insurance coverage. This one, when you offer comprehensive coverage, that can help people with quitting multiple times each year, and then this can be something that's part of their process in supporting your fellow staff members. And then also just educating and communicating with them as well. So whether it's having flyers that are like, here's the impact of tobacco on oral health, and then here's the benefits of quitting. The benefits of quitting start at like 24 hours. And that's benefits that are associated with everything from oral health to heart to other chronic health conditions as well. And so that also has a great return on investment because it does reduce absenteeism because fewer sick days, increase productivity because people may take less breaks and focus more on work. There's a lot of cost savings, which is about $6,000 a year. One thing we know, again, with public health is it saves money in the sense of prevention so that you don't have to pay for the expensive treatments. And also investments with treatment products, they can get that, the amount that you pay in can be completely offset within about 3 years, especially for your high-risk populations, such as pregnant employees and those with chronic conditions. Another thing is making referrals. Quit Partner and ABH, they're really, really great resources and confidential services that support people in Minnesota with quitting on tobacco products. One way that we want to encourage quitting is I would really like for people to connect with our folks from ABH. There's also a program called Quit Partner and Quit Line that is, you're able to call them and they may assign you with a buddy who will help you with quitting. They'll be like your motivation. And almost similarly to how they do sponsors and substance use programs too. And then again with motivational interviewing, so we talked about it a bit this morning with motivational interviewing. And so even if it's not asking patients yes or no questions sometimes, And even especially with youth, asking them if they're vaping, because again, they may not consider it smoking. So if you're like, do you smoke? And for them, it's like, do you smoke cigarettes? Do you smoke cigars? Not, do you vape as well? Because they often use that as its own verb. I say they as if I'm 30 now, so I can say they. But an oral health professional can also help lead those patients down a supportive pathway. And it also, like, in the sense of going through workflows, there is a lot of limited time that you do spend with those patients. And of course, the most important part is that patient care. So that's why we'd really like to promote those resources such as Quit Partner and Quit Line, because they do have the same information about the impacts of tobacco cessation on oral health, and they can help on that end and stick with that patient long term. So they can do the follow-up, they can communicate with the patient, and they can just be their support. And so part of what Claire also said is that, so part of, of course, the standard of care is just knowing if the patient is smoking. And so a lot of this goes to adults, but now people are smoking tobacco products younger as well, especially again, due to the increase in vaping. So when reviewing a history form with patient, when you see that they smoke tobacco, even asking them, do you want to quit? Or are you ready to take that next step? And if they say yes, that's when you can provide them that resource of here's this number you can call or here's this group, and they will be able to assist you with quitting. They will be able to, be your accountability buddy and that type of thing. And so some oral health strategies too is just, again, avoid stigmatizing and praise the quitting behavior. So when you hear someone say, I'm trying to quit smoking, it's just honestly, yay, not yay, but good for you. I'm proud of you. Continue the good behavior. How can I help you? So that way you're not necessarily stigmatizing them, which may make them feel not great about themselves, which can also lead to increased consumption, and you're giving them praise for quitting. And again, every quit starts with a try. This one, again, is more motivational because it's acknowledging that trying is a really, really big step. And that even if during that process you relapse or anything like that, you tried and you can try again. And one of the quotes we had is that, from Clare, is that quitting nicotine may seem like an overwhelming fear. One slip and it feels like you failed. But in fact, the very act of trying is a major success all on its own, no matter the outcome. And there's one more that I didn't include here, but going back to using tobacco for sacred purposes, one of the things people have actually been saying is keep tobacco sacred. Because part of what's happened historically, and I know I have 5 minutes, but part of what's happened historically is that stigmatization of tobacco products, and also way back in the 1800s, people who are American Indian were not allowed to practice religious ceremonies, which led to smoking commercial tobacco. And that's also led to American Indian populations having the highest rates of smoking here in Minnesota too. So it's had a big long-term impact, and it took about 100 years for that to be repealed, but we're still seeing the long-term impacts of that and how it's affected different health behaviors in that community. So again, last note is just keep tobacco sacred. Every quit is a try, and of course, praise the people who you know are trying. That's really, really helpful and important. And so I just have this up. This is that QR code I told you all about, and it's on the MDA website. So please feel free to just go ahead and go to that website and scan it with your phone. And Nancy's sending this presentation out too, so you'll also have it in that format. So these were really great resources. They were done with our SHIP program, State Health Improvement Program, and Clearway when it was there, and the Minnesota Dental Association as well. So yeah. And that is me.